Today, we are going to learn about a very interesting drug which is used in the management of urinary complaints, especially in the elderly. And that drug's name is Tamsulosin. Tamsulosin. So let's try to understand what is Tamsulosin and what it is used for. Well, there are certain special types of structures called alpha 1A adrenoreceptors. Alpha 1A adrenoreceptors in the urinary bladder. Their stimulation leads to contraction of the prostate gland and of the urethral smooth muscles. Now, what is Tamsulosin? Tamsulosin is an alpha 1A adrenoreceptor blocker. So what does it do? It relaxes the muscles in the prostate and in the urinary tract. Tamsulosin is prescribed to decrease the urinary symptoms caused by an enlarged non-cancerous prostate, which is also called as benign prostatic hyperplasia. By relaxing the muscle, Tamsulosin enables a more easy passage of urine and therefore facilitates urination. Now, what you need to know before you take Tamsulosin. Please do not take Tamsulosin if you are allergic to Tamsulosin or to any of its ingredients. The symptoms may include swelling of the face and throat, which is a real emergency, and it is called as angioedema. If you have a history of fall in blood pressure on standing up, which causes dizziness, lightheadedness, or fainting, this is called as postural hypotension. Or if you have severe liver problems. What are the warnings and precautions one needs to keep in mind while taking Tamsulosin? Please talk to your doctor before taking Tamsulosin if you experience dizziness or lightheadedness, especially after standing up, which I told you that is called as postural hypotension. You should sit or lie down until the symptoms have gone. Or if you are suffering from any severe kidney problems, the normal dose of Tamsulosin may not have the expected effect when your kidneys are not functioning normally. If you experience any swelling or in your face or throat, which I told you just now, this is called as angioedema, then immediately you should stop Tamsulosin taking and contact your doctor. And generally then Tamsulosin is not restarted. Then if you are planning to undergo eye surgery for cataract, that is vision loss, and especially if you have some difficulty in seeing blue colors, well, certain complications can occur during this cataract surgery if you are taking or if you have recently taken Tamsulosin. It is recommended you stop taking Tamsulosin 1 to 2 weeks prior to surgery. Contact your doctor and or your urologist surgeon, whosoever it may be, before you go in for surgery to discuss this situation. Now, what is the action of other medicines if you are taking Tamsulosin? Well, these medicines' action can be changed, or they in turn can affect the action of Tamsulosin. You should tell your doctor if you are taking those drugs, and because Tamsulosin might interact with it. So what are these drugs? One is diclofenac, which is a very commonly prescribed painkiller and anti-inflammatory medicine. Now, this medicine, it can speed up the removal of Tamsulosin in your body and therefore shortening the efficacy time of Tamsulosin. There is another drug called warfarin, which is used in blood clotting. So this medicine can speed up the removal again of Tamsulosin, and it can shorten the efficacy of Tamsulosin. There are certain medicines to lower your blood pressure, such as verapamil or diltiazem. Then certain drugs which are used in AIDS, HIV, that is ritonavir or indinavir. Then certain antifungal medications like ketoconazole or itraconazole. If you are taking any other alpha 1A adrenoreceptor blocker, there are so many of them like doxazosin, uh, indoramin, prazosin, alfuzosin, etc. So if you combine tamsulosin with these drugs, the combination might lower the blood pressure and again causing dizziness or lightheadedness. If you are taking erythromycin, an antibiotic which is used to treat infection, that can also have an interaction with tamsulosin. What about tamsulosin interaction with food or drink? Well, you should take tamsulosin with a glass of water after breakfast or after your first meal of the day. Does tamsulosin affect driving or using machines? Well, there is no information as of now on the effect of tamsulosin on the ability to drive or use machine. But you should take into account that tamsulosin can cause giddiness or dizziness or lightheadedness, and therefore you should drive or use machinery only if you feel all right. Tamsulosin contains sodium, but the amount of sodium is very minimal to the extent of something like 23 milligram per tablet. So essentially, practically, tamsulosin can be labeled as sodium free. How to take tamsulosin? Please always take this medicine exactly as your doctor has told you. Check with your doctor if you are not sure. The recommended dose of tamsulosin is 1 tablet or capsule of 0.4 milligram per day, taken after breakfast or after your first meal, as I had already told you. Please swallow the tablet or capsule whole with a glass of water while standing or sitting, but not while lying down. It's important that you do not crush or break the tablet or the capsule, because it may influence how well the tablet, that is the drug, tamsulosin, might work. Well, if necessary, your urologist or your doctor may prescribe even 2 tablets or capsules once a day. What happens if you are taking more amount of tamsulosin? Well, as I told you earlier, your blood pressure might drop if you take tamsulosin more than you should, and therefore you might experience dizziness, weakness, fainting, and therefore you should lie down to minimize the effect of low blood pressure and then immediately contact your doctor. Your doctor may give you medicines to restore the blood pressure, and he may monitor your body functions as well. If necessary, your doctor may empty your stomach and give you a laxative to remove any tamsulosin not taken up by the blood in the body. What happens if you forget to take tamsulosin? That is also a possibility. Well, please do not take double dose to make up for a forgotten dose. Just take the next dose at the usual time. If you have any further questions on the use of this medicine, of course, you should ask your doctor.